Hello everyone, this is your friend Charmel Lima. Thank you for coming back to this video. Thank you. If you're new to this channel, I would highly suggest you to click subscribe on this video, subscribe to my channel, because I make a lot of nice videos about medical things in general. So if you are interested about medical things, what happens in the medical world, this is a channel, this is one of the channels you want to follow or subscribe to. So feel free to do that. And today we're gonna talk about amoxicillin. I'm sorry I haven't uploaded in a while, but today I'm back with a video about amoxicillin. So as I'm speaking, I'm going to read my notes here about amoxicillin. So amoxicillin is also called amoxil, amoxi, larotide, lin amox, moxatag, novamoxin, or new amoxil. So this medication is actually an antibiotic or anti-infective, and or also an anti-ulcer. So people use amoxicillin for a lot of different problems, a lot of different things. So it's a lot, but I'm gonna give you some of them. So you can use amoxicillin for skin treatment if you have like a skin problem, like an infection or something, because it is an antibiotic. For like a respiratory, GI or GU infections, GI and GU, gastrointestinal or genitourinary infection, otitis, which is basically an infection, inflammation really of the ear, but that inflammation can be caused by an infection. So that's when amoxicillin will come into play. Amoxicillin is also used for gonorrhea, gastric ulcers, which can be caused by a bacteria. Also, it can be used to like fight off gram-negative bacilli. Bacillus is like the shape of a bacteria, which is basically a bacilli is like something like a cylinder. Like bacteria that have the shape of a cylinder, like the long bacteria, just like E. coli or like Listeria. So some of the other things that people use amoxicillin for are Lyme disease, anthrax, cervicitis, which is basically an inflammation of the cervix, which can be also that inflammation can be also caused by an infection. It can be used for dental problems, like if you have a dental infection or like an abscess in your like gum or like around your teeth, you can also use amoxicillin. And also some doctors will use amoxicillin to like fight off like a urinary tract infection. And talking about that's like GU, genital urinary tract, but talking about GI tract, about ulcers in the GI tract, in the stomach, like ulcers. Those ulcers can be caused by a bacteria called Helicobacter pylori. They usually abbreviate it to like H. pylori, which like digs holes into your stomach, and that causes like wounds in your stomach, and that's basically the ulcer, because the acid that is in the stomach normally is gonna, because there is no lining where the holes are, the holes caused by H. pylori, because of those holes there's no lining, so the acid that is naturally in the stomach is gonna enter the hole, the wound actually, and that really hurts. So some doctors will prescribe amoxicillin to like kill the bacteria that is causing those wounds in the stomach. So when they are no longer causing creating more holes or wounds in your stomach, then the other medication will be there to like close off the holes, heal the wounds in the stomach, and then you'll hopefully be back to normal. So now that we talked about the uses, like what you can use amoxicillin for, we're gonna talk about what it actually does in the body. So let me read this literally, and I would translate it in English, I guess. So the action is, it interferes with the cell wall replication of susceptible organisms, bacteriocide, Okay, it is bactericidal, lysis mediated by bacterial cell wall autolysin. Okay, so actually what amoxicillin does is that it blocks the replication of the cell wall. I know I just repeated what it says, but in English it will mean that when a bacteria they replicate really fast, like they reproduce themselves very fast. So what amoxicillin does is that it stops the replication. It stops the fact that the bacteria would divide itself, because usually one bacteria can like multiply into two in less than 24 hours usually. Some of them are like more than 24 hours. They take more than 24 hours to replicate, but most bacteria, they need less than 24 hours to replicate at least once. So when there is one bacteria and they replicate, so it's like two of them now, and then those two can replicate again. So what amoxicillin does is prevent that replication. So they said that it's also bactericidal because it actually kills the bacteria. It talks about autolysin. So that's an enzyme. I want to believe that that's an enzyme that causes the bacterial cell wall or cell membrane to like lyse, to like explode, like rip. So it's not just to regulate, like to stop the bacteria from replicating, but it's also to kill the actual bacteria itself, the one that's gonna replicate. So it's actually like a pretty good method to like kill off bacteria, because it not just slows the replication of the bacteria, but it actually kills them. So there are obviously some contradictions. I mean contraindications. There are two main contraindications. So if you're pregnant, make sure you talk to your doctor before you take amoxicillin, even if the doctor already prescribed it to you for a previous pregnancy, because pregnancies are different. So you might, for your first child or like second child, you might, your doctor might have prescribed you amoxicillin if you had like an infection or something. But it might not work for your second pregnancy, because it depends on the pregnancy, how the pregnancy is affecting you, and how the medication is going to affect the baby, because each baby reacts differently to medication and like treatment, stuff like that. So make sure you talk to your doctor if you're pregnant. Are we good on that? Good. Thumbs up for you. Also, another contraindication is if you're hypersensitive to penicillin, then don't take amoxicillin, because amoxicillin is really an amino penicillin, which means that it's like a sort of penicillin which reacts most with like amino means like protein. So I want to believe that the protein they're talking about is the lysin or autolysin that makes the bacteria kill itself. So I want to believe that's the amoxicillin is a kind of is in the penicillin family. So if you're allergic or like hypersensitive to penicillin, do not take it, and let your doctor know before he prescribes that to you too. That's why usually doctors ask you, are you allergic to any medication? Is to know if another medication will work for you or not, because even though there are different medications and they have different names, they might be from the same family and affect you the same way. Also, not only pregnant women, but if you're breastfeeding also, you want to talk to your doctor first before you take amoxicillin too, because of the same reason. The baby who was there and who is born now, and feeding from your milk, like, because medication goes right in the breast milk, and that can go into the baby, and that can be not very good. Some doctors don't like to prescribe medications to pregnant women or like nursing women, not because it's not good for them or the baby, but they just don't want the baby to be like to have something that they don't need. So if you don't have an infection and you take a medication, then your body gets used to that medication and it becomes no longer useful, or if the bacteria was there but dormant, which means it's not reactive, it's not causing you any problem. If you take a certain medication a lot, then it makes the bacteria resistant to that medication. So that's why if there's nothing wrong with the baby is fine, then they don't want the mother breastfeeding to take the medication because it will go eventually to the baby. And if the potential bacteria that would otherwise be killed by amoxicillin, then that bacteria would be resistant to amoxicillin now. So when the baby if the baby actually contracts any other infection, then it wouldn't work for the baby anymore because the bacteria would have been resistant to it. Okay, now let's talk about side effects. We're gonna break down the side effects by category. So let's talk about the central nervous system first, which includes the brain, the spinal cord. So amoxicillin can give you headache, agitation, confusion, dizziness, insomnia, or in very rare cases it can give you it can make you have a seizure, but that's on very rare cases. Let's go down to the GI tract, the gastrointestinal tract. It can cause you, one of the very popular side effects of any medication is nausea, vomiting, diarrhea. So amoxicillin has those side effects. Another side effect can be abdominal pain or cramping. Now let's talk about the blood. The amoxicillin might give you anemia. And let's talk about the integumentary system, the skin. So it can give you maybe a rash. Even though that medication has a lot of side effects, so does any other medication, and those side effects are rare depending on you. And because even though it has a lot of side effects which are different from person to person, you might not experience any of those side effects, or some people might experience all of them. And if that happens, then you need to let your doctor know, and that's how they know that that medication is not good for you. If every medication has some side effects. So if the doctor looked at your profile and looked at what's going on with you, and he sees that what the good is gonna do to you outweighs the side effects, then he's probably gonna prescribe it to you, and hoping that none or very few of the side effects actually happen to you. Let's talk about the pharmacokinetics, which are really how the medication works, how long, and like the action time and stuff. So when you take it by mouth, it usually stays in your body for like 6 to 8 hours, and the peak is usually after 1 or 2 hours after you take it by mouth, and the half-life is 1 hour to 1.5 hours. The duration, the pharmacokinetics are very important to doctors in prescribing how often you're going to take that medication, because if the medication is as amoxicillin, if the medication is in your body for like 6 to 8 hours, then we don't want to run out of it, because the bacteria is gonna see that, oh, it's not enough in the body, so I can tolerate a little bit, and they use that little bit to become resistant to it. So you want like a certain level in the blood. You want to maintain a certain level of that medication in the bloodstream. So that's why doctors will prescribe that medication. Sometimes they will prescribe it like for like 2 times a day for like 10 days, which is the typical prescription. So you take 2 in the morning and 2 at night for 10 days. Sometimes some doctors will prescribe it differently, but it depends on the duration, like how long is it gonna be in your body and what the dose is, basically. So some of the things that you should watch out for when you're taking that medication are, if you're taking the medication and you don't feel any better, you don't feel any difference after so let's say the doctor prescribed the medication for like 10 days. So if after the 5th day you don't feel any better, or if you're feeling worse than you were before, you might want to call your doctor. And that's for any medication altogether. And if you are feeling better but other things start to show up, like a rash or like I don't know, maybe like cramping that is too strong, or like you start seeing like blood in your stool or something like that. If you were not seeing that before and then you see it after you start taking the medication, you want to give your doctor a call or like show up to their office and talk to them about it, because that shouldn't be right. The medication is meant to make you feel better, not worse or not any different than the normal you were before you got sick for that specific thing that you're taking the medication for. Also, make sure when you get the prescription, whether you get it at the pharmacy or directly from your doctor, you know, some offices do that, make sure the cap is not open, because if it's open, then air like entered, and you know, there is sometimes particles or like bacteria or viruses in the air. Sometimes it's not like you're breathing every day, and if you're healthy, then that's totally fine. But sometimes if it was in the pharmacy and it was open in the pharmacy, you don't want to take that medication. It has to be like it has to be closed and sealed, so you have to make sure it was closed. If it was open, please return it to the pharmacy or whoever gave it to you. Usually doctors want you to take amoxicillin with water, you know, with water and fluid in general, but water is preferable. And also some people would try to double the dose if they missed it. Like let's say you were prescribed for 10 days. You know, 10 days is a long time. Like, people forget. Like, even me at my age, sometimes people tell me you're too young to forget that, but it happens to everyone. Like, forgetting is part of life, I guess. So if you were prescribed the medication for a certain amount of time, you might forget to take like one dose, and it's a really good thing if you remember, so that you can make it right. You can call your doctor and ask them, doctor or nurse, they can help you. They can tell you if it's okay to like double the dose, or like just forget about it and like take the next dose and continue as if nothing happened. And just make sure you're regular on this, like you're on the schedule for the future times. So don't self-medicate yourself and think, oh, I missed the morning, so I'm gonna double it at night. That might not work for your specific case. So talk to a nurse or a doctor first. Make sure you take the entire course. If the doctor prescribed you to take the medication for 10 days, 2 times a day for 10 days, make sure you take it 2 times a day for 10 days. Usually they give you exactly the amount they want you to take in the bottle. So if there is anything still in the bottle, you should be concerned, because the doctor prescribed that to you for a reason. And to avoid resistance of bacteria in your body, then you want to take that medication all the way through. Okay, pal? I trust you. Do it right. Let's get it. This is all I have for you guys about amoxicillin. And if you enjoyed this video, or if you learned from this video, give it a big thumbs up, and comment below what you think. If you're taking amoxicillin right now, for what, or if you're not comfortable doing that, let me know what other medication you would like me to talk about next. And I need to say this before I close this video. Oh, first I need to say subscribe to my channel, because I make a lot of fun videos about the medical world, the mysterious medical world that everybody wonders about. Everybody, you know, at some point, unless you are like a very, very, very lucky person, everybody gets sick once in a while. So you might want to, I need to close this video because my battery is dying now, the battery of my my camera. But I need to say this, I'm not a doctor. I want to be a doctor someday, so I'm not a doctor yet, but I will be a doctor soon. I will be a doctor someday, and I'm learning those things to be prepared for when I become a doctor. And I'm gonna be a wonderful doctor. Hopefully, I want to be a wonderful doctor for myself and for you guys who are gonna be my patients someday. And now I can close the video. But remember, I'm not a doctor, so you don't sue me if I said anything that was not very accurate. So thank you so much for watching. Make sure you like this video, comment below what you think about it, and share this video with anybody who you think might learn from this video. And also subscribe to my channel, and I'll see you guys in my next video. But before I go, I want to remind you to stay hydrated. Always drink water.